Our group chose to do leukemia, and the four groups we talked about were the skeletal system, the circulatory system, the muscular system, and the nervous system. And we're just going to highlight a few key points.
So leukemia starts off in the bone marrow. This is where the blood cells are formed. The stem cells divide to produce either more stem cells or immature cells that become mature over time. And a key point is leukemia causes joint and bone pain.
Okay, so the system I had was the circulatory system. So as most of you know, leukemia is a cancer of the blood, but more specifically, it's when your body creates defective blood cells. So this affects our body because our red blood cells carry oxygen, our white blood cells help us fight off infections, and our platelets help with coagulation. So when these cells are deformed, it'll disrupt these functions. Some of the effects that could have on the body is anemia, easy bleeding, and it can cause infections. A couple treatments are chemo and radiation therapy to kill the cancer cells.
The muscular system has 5 major functions, and of those functions, it includes the movements of the bones and the blood. A symptom of leukemia, as Ashley said before, is anemia. And anemia is a dwindling number of red blood cells, which makes it very hard for oxygen to get to the muscles and other organs of the body. Muscle fatigue and muscle loss are very common with leukemia because, as stated in lectures before, if you don't use it, you lose it. And fatigue can occur due to the lack of ionic imbalances or lack of ATP during states of ongoing contractions.
Leukemia can affect the central and peripheral nervous system. Damage to the nervous system is often related to doses of chemotherapy that are given. The central nervous system damage more commonly occurs in patients who have received radiation therapy to the brain or chemotherapy that is injected into the cerebrospinal fluid. I actually have an older brother named Jared who has leukemia, and his treatments have had some effects on his nervous system. He often needs assistance when he's walking because he becomes very weak and shaky due to the chemotherapy treatments. And he recently had a bone marrow transplant, and they had to customize a helmet for him because some things that he can experience after are loss of consciousness and dizziness when walking. But luckily they are just short-term effects and they will eventually go away as the disease improves.
'Cause baby, now we got bad blood. You know it used to be mad love. So take a look what you've done. 'Cause baby, now we got bad blood.
Hey, I can't take it back. Look where I'm at. We was OG like DOC, remember that. My TOC was quite OD, ID my facts. Now POV of you and me, similar Iraq. I don't hate you, but I hate to critique, overrate you. These beats of a dark cart use bass lines to replace you. Take time and erase you. Love don't hear no more, no, I don't fear no more. But yet respect ain't quite sincere no more.
Oh, it's so sad to think about the good times, you and I. 'Cause baby, now we got bad blood. You know it used to be mad love. So take a look what you've done. 'Cause baby, now we got bad blood. Now we got problems, and I don't think we can solve them. You made a really deep cut, and baby, now we got bad blood.
Hey, remember when you tried to write me off? Remember when you thought I'd take a loss? Don't you remember you thought that